So Marianne, can you tell me again about Twitter and how at Biogen that we're utilizing your platform?
Sure. So I think we were talking a little bit about the patient experience and how when people are diagnosed with any condition, the first thing that they do or that they want to do is to find that person who's like them. So what they do on Twitter is they look for patient communities, they look for people who are going through what they're going through, and then they reach out to those people to talk, those patient groups to talk about their diagnosis, their doctor, the medication that they may have been prescribed, the hospital that they may be affiliated with, their families, their caregivers, all of those things that, in the old days people would talk about maybe at a support group. Twitter has created a global virtual support group for a whole bunch of different conditions. And we see so many different patient groups that are really active on the platform. And it's been really interesting. We were talking a little bit earlier, I was saying my mother was diagnosed with MS in 1981, and how joining a support group was such an endeavor in terms of my father worked in New York City and he was busy, and he was the only one who was working in the family, so he was out working. And like neighbors would drive my mother to her support group, and then it would snow, or it would be they would have a scheduling conflict, or my mother over time had mobility issues, and then it was too hard for her to go. The idea of a virtual support group is so amazing because people can connect with each other and talk about really important things that help, I think, just holistically the patient outcome, but like improve their lives and improve their coverage.
Well, I know when I shared with you, I was diagnosed with MS back in 2006, and I can still remember that day that I was diagnosed, but what made the biggest impact was when I connected with one of my girlfriends who also had MS, and that, it was better than going to an MS neurologist or speaking to a nurse. That connection with another person that has that same disease that you have made a huge difference. And it was like, I knew I wasn't alone. I knew that I wasn't crazy, because I often thought that there was, is this all in my head? Because of just some of the symptoms. And it, took over 2 years for me to get diagnosed. And so I questioned, was this all in my head? And a physician actually said, I think it's all psychosomatic. And so, when I was able to connect with someone and understand, like, she was experiencing the same things, it made a world of difference. And so I just didn't realize, though, you could do it on Twitter.
Yeah, which is pretty amazing. And I was at Google for a long time. And so for me, when I was at Google working in health, it was all about discovery of information and having access to that information. And that had never really happened before in the way that it happened when Google was kind of making everything accessible to people and to doctors. And Twitter kind of, to me, continues that journey because it's where the conversations are happening. And I had been there just a short amount of time, and a woman reached out to me on LinkedIn and wrote me a letter that made me cry at my desk. And she was a breast cancer survivor. And she said, I just want to thank someone, but I don't know who to thank. And Twitter literally saved my life. She said, I was a young mother of an infant child when I was diagnosed with breast cancer. I was in an unusual situation. I didn't know anyone else who was in my specific situation. And I found people who I could talk to. And she was like, if I had chemotherapy-related insomnia in the middle of the night, I knew somewhere in the world I could find someone by following a hashtag conversation who I could talk to, and I wasn't alone. And I think, like to your point earlier, there are the main facets and parts of a condition that the doctor talks to you about, and then there are all these other things that the doctor doesn't talk to you about. And I remember as a kid when my mother had MS, there were a lot of things that were changing that we didn't understand, that no one ever talked to us about, and that weren't really very well known. And I think those are the things that for patients who feel alone, to be able to connect virtually with someone is so powerful. And now I think these groups they've really built up and they've gotten stronger. And so now not only are there groups that are MS, lupus, breast cancer, like specific conditions, but now a lot of the leaders of those groups and the patient activists in those groups kind of talk to each other too. And I think that's really helped kind of further a lot of the conversations and help people improve their outcomes and how they think about the medicine they take and how they think about their treatment.